Medicaid Work Requirements, FAQ. Introduction. On June 1st, 2026, the Centers for Medicare and Medicaid Services, or CMS, issued an Interim Final Rule, or IFR. An IFR is a policy implementing new Medicaid work requirements, also known as community engagement requirements. The Medicaid Work and Community Engagement IFR is extremely long and complicated. The IFR that CMS released on June 1st does not go into effect until January 1st, 2027. Because of this, AAPD will, over the next 6 months, provide many tools and resources to help the disability community prepare for the changes coming on January 1st, 2027. AAPD will provide multiple explainers, each focused on different parts of the IFR, to make this policy easier to understand. This first resource from AAPD addresses some of the most urgent and common questions, misconceptions, and fears we are hearing from the disability community about this policy change. Information about how to make sure you get all of AAPD's resources and analysis is at the end of this resource. This resource has been updated to clarify the states that the requirement applies to, clarify that some exclusions require an additional demonstration of inability to comply with the requirement, add that Social Security disability determinations count even if you are not receiving Social Security benefits, clarify that work training must be part of a formal program, and to fix a typo about the ages to which the Medicaid expansion applies. Frequently asked questions. Question: is it now required that some people who receive Medicaid must be enrolled in some form of employment, education, training, or volunteering beginning on January 1st, 2027? Answer: yes. Last July, Congress passed a bill called H.R. 1, which created community engagement requirements, or work requirements, requiring some people to complete at least 80 hours of work, volunteering, school, or training per month to maintain their Medicaid eligibility. Question: can I meet the requirements through a combination of education, work, and volunteering? Answer: yes. The IFR allows Medicaid recipients to meet the work requirements through a combination of activities, including education, work training, and volunteering. Question 3. Question: will people with disabilities be automatically exempt from the work and community engagement requirements that start on January 1st, 2027? Answer: no. Not all disabled people will be automatically exempt. The rule includes exemptions for many people with disabilities, but not all. People without disabilities also qualify for certain exemptions. Here is a full list of all the different groups of people who are covered by exemptions. If any of these categories apply to you, you should be automatically exempt from fulfilling work requirements. 1. Are under age 19 or over age 64. 2. Receive SSI or SSDI. 3. Are entitled to or enrolled in Medicare. 4. Are receiving SNAP benefits and are not exempt from the SNAP work requirements. 5. Already meet the work requirements in the Temporary Assistance for Needy Families, TANF program. 6. Are in a substance use disorder treatment program. 7. Are pregnant or receiving postpartum Medicaid coverage. 8. Provide caregiving for children under 14 or for other disabled people. 9. Are veterans with a total disability rating from the VA. 10. Are former foster youth under the age of 26. 11. Have been recently incarcerated within the last 3 months. 12. If you are part of a group the policy describes as American Indians, if you identify with any of the following, this group applies to you: Indigenous people, Native Americans, Alaska Natives, members of federally recognized tribes, or individuals who qualify for health care through the Indian Health Service. 13. If you have any of the following conditions, and that condition substantially impairs your ability to fulfill the work requirement. The first condition is a physical, intellectual, or developmental disability that significantly impairs your ability to perform one or more activities of daily living. The next is a serious or complex medical condition. The next group is what CMS calls, quote, disabling mental disorders. This likely means disabling mental health disorders, but you will need to see how your state defines this exemption. The fourth group is if you are blind or disabled according to the definition of the Social Security Administration, either for SSI or SSDI, even if you are not currently receiving benefits. And finally, people with substance use disorders. Question 4. Question: does this rule only apply to the Medicaid expansion population? Answer: yes. Medicaid expansion population refers to adults aged 19 through 64 in the 41 states that expanded Medicaid under the Affordable Care Act, or the ACA. Many people with disabilities are insured through Medicaid expansion. States that expanded Medicaid through the ACA will be required to implement work requirements for adult Medicaid recipients who don't qualify through any other Medicaid program. The requirements will apply in the 41 states that expanded Medicaid. Those are Alaska, Arizona, Arkansas, California, Colorado, Connecticut, Delaware, Hawaii, Idaho, Illinois, Indiana, Iowa, Kentucky, Louisiana, Maine, Maryland, Massachusetts, Michigan, Minnesota, Missouri, Montana, Nebraska, Nevada, New Hampshire, New Jersey, New Mexico, New York, North Carolina, North Dakota, Ohio, Oklahoma, Oregon, Pennsylvania, Rhode Island, South Carolina, South Dakota, Utah, Vermont, Virginia, Washington, and West Virginia, plus Wisconsin and Georgia, and a small number of people in Tennessee. The work requirement also does not apply to Alaska Natives, Native Americans, or those who reside in the U.S. territories. Question 5. Question: can the IFR be changed? Answer: maybe. While the IFR is final, there is a 60-day public comment period. CMS will accept comments on the IFR until July 31st, 2026. If enough individuals, organizations, and state Medicaid directors submit comments opposing the rules due to the barriers people will face in qualifying for an exemption or in meeting the work requirements, it is possible that CMS may revise the IFR accordingly. AAPD will draft comments and send an action alert to those who have signed up for our emails, including an easy-to-use template for submitting comments in early July. Question: what is the point of commenting on the rule if the rule is already final? Answer: good question. While there is no guarantee that public comments will lead to changes in the IFR, public comments do become part of government records and inform regulators of challenges faced in complying with federal regulations. Comments left on this regulation may also inform future rulemaking processes. Future administrations may use comments to justify changes to this rule, or learn from the comments how they can avoid similar problems in their regulatory processes. Question 7. Question: will every state implement and enforce the requirements in the same way? Answer: no. The CMS rule on work requirements includes several areas where states will have discretion to set their requirements as broad or narrow as they wish, including which conditions or diagnoses they accept as a serious and complex medical condition, which is one of the exemptions. Make sure you keep an eye out for any letters, emails, phone calls, or other communications from your state Medicaid agency in the coming weeks. Question 8. Question: is there any way I can influence how my state implements these requirements? Answer: yes. State Medicaid agencies will begin designing and planning their implementation of Medicaid work requirements very soon, if they have not already. Between now and the fall, you can contact your state Medicaid agency and provide information for them to consider when designing and planning how they will implement the work requirements. AAPD will provide an opportunity for community members to write to their state Medicaid directors via our action alerts in the near future. AAPD will also send our own letter to state Medicaid directors, reminding them of the importance of engaging Medicaid recipients, particularly those with disabilities, while they prepare for implementation. Outreach to state Medicaid directors should happen as soon as possible. Federal law and CMS regulations mandate that states engage in direct outreach to Medicaid recipients to notify them of the work requirements at least 3 months prior to implementation, which means states are preparing now to conduct outreach soon. Question 9. Question: can people lose Medicaid even if they qualify for an exemption? Answer: yes. Under the Medicaid Work and Community Engagement IFR, each state must determine whether individuals meet work requirements or qualify for an exemption. Work requirements place overwhelming administrative burdens on states and enrollees. This means that work requirements require states and people who receive Medicaid alike to stay on top of many different kinds of paperwork, forms, and communications. This administrative burden may cause people to lose coverage, even when they should remain eligible. For example, state Medicaid agencies may not have the staff to handle the enormous task of reviewing who is eligible for an exemption. Many disabled Medicaid recipients who are not automatically exempted will have to provide proof of identification, medical history, and daily activities. Issues like being unable to find a specific piece of paperwork or missing a piece of mail while out of town can be the difference between keeping and losing Medicaid. Question 10. Question: does the IFR require each state to check whether people meet work requirements? Answer: yes. States must check compliance with work requirements whenever someone applies for or renews Medicaid. States may also conduct additional compliance checks more often than just during application and renewal. If a state can't verify compliance or grant an exemption, it can initiate a process that may lead to denial or termination of coverage. As a result, eligibility and coverage may differ across states. Question 11. Question: what will it mean for states to assess and determine whether people meet the work and community engagement requirements? Answer: it will depend from state to state, but here is a general outline. States will use existing wage data, Medicaid claims data, Social Security Administration data, and more to try to verify compliance with the work requirements or to exempt those who fall under one of the exemption categories. If the state Medicaid agency does not have enough information to determine whether you are in compliance with the work requirements or are eligible for an exemption, they will reach out to you to request more information. Some individuals may need to provide documentation to their state Medicaid agencies to prove that they meet the requirements for an exemption, such as medical records, proof that they are a caregiver for a child under the age of 14 or an individual with a disability, have a substance use disorder, or other documentation of their eligibility for exemption. If you do not qualify for an exemption, your state Medicaid agency will send you information on how to submit proof of compliance with work requirements each month. Question 12. Question: does enrollment in school at least half-time meet these requirements? Answer: yes. People enrolled in school at least half-time, as is defined by the school, meet the requirement and do not have to perform any additional work or volunteering. People enrolled in school less than half-time can still meet the new requirements through a combination of school, work, and volunteering. Question 13. Will caregivers of people with disabilities qualify for an exemption? Answer: some will. The IFR includes exemptions for certain parents, guardians, caretaker relatives, and family caregivers of people with disabilities. This can include caring for relatives, people you live with, or people you aren't related to and don't live with, if you provide 80 hours of caregiving activities per month. Hours of unpaid caregiving work can also count as work hours for meeting the work requirement. 14. Question: If I meet the requirements for an exemption once, do I need to prove my eligibility again in the future? Answer: yes. If you are a Medicaid recipient, you will generally need to prove that you meet the criteria for an exemption from the work requirements when you apply for Medicaid, and at least annually, or every 6 months, or more frequently, depending on your state. States will use existing data to automatically exempt qualified individuals whenever possible. If they do not have enough information, they will contact you to request information. Question: do Indigenous people and Native Americans have to meet the requirement? Answer: no. Indigenous people and Native Americans, referred to in the IFR as, quote, American Indians, including members of federally recognized tribes, Alaska Natives, or anyone who receives health care from the Indian Health Service, do not have to meet the requirement. 16. Question: I receive supplemental security income. I receive SSI or SSDI. Do I have to fulfill any work requirements? Answer: no. Those who receive SSI or SSDI are exempt from the work requirements. However, automatic exemption will depend on how your state implements the requirement and whether you encounter any administrative hurdles, such as needing to provide your state Medicaid agency with documentation of your disability diagnosis, verification of your SSI or SSDI benefits, educational enrollment, earnings, veteran status, or other proof. The state may also ask your healthcare providers to certify whether you are significantly impaired from performing work, volunteering, or attending school. 17. Question: I am disabled, but not on SSI or SSDI. Do I qualify for an exemption? Answer: maybe. You can still qualify for an exemption, but you may need to submit additional documentation to be eligible. There are 9 other exemption categories beyond receiving SSI or SSDI. They include: 1. Certain parents and caregivers. 2. Pregnant and postpartum individuals. 3. Disabled veterans with a 100% disability rating from the VA. 4. Former foster youth age 19 to 26. 5. Recently incarcerated people. 6. Anyone who already meets the work requirement for the Temporary Assistance for Needy Families Program, or TANF. 7. Anyone who receives SNAP and is not exempt from the SNAP work requirement. 8. People currently in substance use disorder treatment. 9. People with the following conditions, if the condition impairs their ability to comply with the requirement. The first group is people with physical, intellectual, and developmental disabilities. The second group is people with what the IFR calls disabling mental disorders. The third group is people with serious or complex medical conditions. The fourth group is people with substance use disorders. The fifth group is people who are blind or disabled according to the definition of the Social Security Administration for receiving SSI or SSDI, even if you are not receiving benefits. 18. Question: if I lose my Medicaid coverage because I did not comply with the work requirements or qualify for an exemption, can I get it back? Answer: yes. If you believe you met the work requirements, qualify for an exemption, or received a notice of disenrollment in error you can file an appeal with your state Medicaid agency. If you lose your Medicaid coverage and then your health status changes, your income drops, or you meet the work requirements through enrollment in an educational program, paid work, or volunteering, you can reapply for Medicaid at any time. Question 19. Question: when will these requirements go into effect? Answer: January 1st, 2027 for most states, but not all. The deadline for most states to implement these requirements is January 1st, 2027. Nebraska, Montana, and Iowa have chosen to do so earlier. CMS has already instructed states to begin informing Medicaid beneficiaries about the kinds of changes they should expect as early as this month. Conclusion: AAPD will continue to share resources, action alerts, and webinars in the coming weeks and months to explain the new Medicaid work requirements more fully, including what they mean for you and how to find help navigating these new requirements in your state. You can stay in touch with AAPD by signing up for our emails and following us on social media. Both of those links can be found below this video. Make sure to visit aapd.com/Medicaid for updates and new resources. New resources are added frequently.